So all those things, I really, really heard a lot of stories, a lot of different sharings about their mental health issues, and so uplifters, and these migrant writers of Singapore also became a way for me to be connected, to be a friend, to be a sister to those who are having so much difficulties during that really, really challenging time last year. So up to now, and I found myself doing some good things about educating them, helping them out, and it really helps a lot also that my employers, the psychologists, and so sometimes when there are things that are really very difficult for me to explain or to understand, and I always ask for her advice on how should I advise them, how should I tell this to them that they can how can I help them in this matter, in this thing that they are suffering. So that's really an pandemic gave way for me to connect more to people, to connect more to the community, where I feel myself that I am needed, and I can do something for them.
Thanks, Shanti. Your story is very inspirational, and also you can inspire a lot of migrant workers who are working there as well, from all the initiatives that we are part of. So adding to that, I'd like to understand and learn from Jerome. So how you've been a part of the migrant workers in Singapore. So in terms of your experiences, would you like to highlight how during the pandemic and before the pandemic, how you have helped the community here?
Before the pandemic and during the pandemic?
Yes.
I think my journey really started, my journey started also sort of small journey, and then a long time ago, more than 5 years. And I think at the time, we just also at the time focused on health issues, still focus on health issues. But at the same time also, there were workers that were owed salary. And I remember when the company closed down, almost close to 60 workers walked in, and they were seeking for food assistance. And I realized, hey, salaries are actually a big issue in Singapore. Because the workers had difficulty reclaiming their salaries when the company was going bust. But it also raised to me, that salary dispute mechanisms in Singapore are also problematic, and that there are gaps in the system that prevent people who are low wage from seeking adequate costs. Yeah, so I mean that sent me on a whole journey to find out a bit more, to go deeper, and to go beneath the case. And I think anchoring me, being led by my faith to yearn for a society where we have right relationships and where people treat each other justly, and we talk about loving and being inclusive, that it translates to very tangible things like paid salaries, like being able to access basic healthcare, being able to be transported on a decent vehicle, right, given the recent state of accidents, even the freedom to transfer employers. And I realized that these issues came up as I go in deeper. So I've been in this scene about 5 to 6 years right now, and so during this time, I have encountered workers who haven't had problems seeking recourse in terms of salaries, had problems seeking assistance when it came to healthcare, or seeking adequate healthcare. And so, I was previously a caseworker at home, so I basically fought to make sure that they receive these basic services. And also were able to negotiate adequately with their employers to reach as good outcomes as possible. Yeah, so in the COVID pandemic, we knew that, especially when circuit breaker hit, we knew that this was going to be a problem, that workers wouldn't be able to come forward to seek for assistance. And we knew that this restriction would also adversely affect their mental health. We didn't know how bad it would be and how much stress this would be on the population group. But we felt bunch of social workers and myself, we felt that we should come together and offer them support. So during the pandemic, we received requests from the helpline. Quite a number of us, social workers, are assist trained, we call suicide intervention training. So we provided them the helpline, and we had workers that were calling in asking for support. So we were sending things out, but also triaging psychological risk, and also educating them, psycho-educating them on the necessary avenues of recourse that they need to they need.
Thanks. Thanks for highlighting your experience. Adding to the psychological therapy you provided, I would like to understand from Dr. Carol on the importance of the psychosocial and support that you are part of.
Sure. Psychosocial support is extremely important. You can hear from Jay, you can hear from Siobhan as well that it is a form of support